Is a good place.
Yes.
Don't miss our show, Devil's Advocate, every Tuesday night at a new time slot.
I gotta fix that.
Only on WJMU 89.5.
The Claw.
Hey, we're back on 89.5 WJMU The Quad. This is the Faculty Lounge. I'm Dr. Scott Lambert. I'm here with my wife, Jamie Whitmer, and today's guest, John Blakeman. And I have one piece of housekeeping work to take care of first.
Yes.
Devil's Advocate is not on Tuesday nights at 8 o'clock. What time is it on now?
Wednesday afternoon at 2 o'clock.
Wednesday afternoon at 2 o'clock. And Jason is very good on that. I always
And what
take
is
his side.
What is Devil's Advocate?
It's a. Oh, I'll take that for a second. It's a show where me and my counterpart, Avenue or Lane Casper, we generally talk about our lives, what's going on, but we also, discuss controversial topics. Sometimes we'll debate, sometimes we'll just discuss them, and it's a pretty good program.
Oh, that's
if I
cool.
do say
Yeah.
so myself. Me and her are finalists for the awards coming up for IBS for best on-air co-host.
Oh, cool.
Or on-air personality, which would be a really nice award to win, especially when you're going into radio. So
Yeah. No,
Yeah,
that's way cool.
and that's-
Congratulations on even being up for that,
You've got a number of people from WJMU on and out this year.
we do. We have a lot of people, seniors about to leave, but we've got seven awards, maybe 8 that we're finalists for. So it's gonna be a good time in New York.
Very good, very good.
But back to the important show.
Back to what we're doing now. Our own version of Dr. Radio.
Yes. Live.
Yeah.
Live from the studios at Millikan University.
The future presidential Medal of Freedom winners.
Well, now, I don't want to get talking about that because then I
We're
will
gonna
get
get
angry.
Yeah, then we're going to get distracted.
All right.
and
What I
nobody
do
wants
want to
about
talk about, we'll talk about Rush at the end because I'm sure I'll have a moment or two to just completely go on a rant. But before we do, I do want to talk about the coronavirus. And you two Jamie has been doing an awful lot of work every day. If you guys are on Facebook, you should follow her page, Jamie Whitmer, APN, something.
It's APRM, but yes, that's if you plug in Jamie Whitmer, I'm sure I pop up.
Yeah, it's a gorgeous picture of her, too. I loved that photo of her. I really did. It's one of my favorite photos of her. I embarrass her. So tell me about the coronavirus.
So the coronavirus was first, I hate to say founded, but first isolated and identified as this is what this is at the end of December. There were a cluster of unusual pneumonia cases in Wuhan, China, and they weren't responding to treatment. They did a bunch of testing to try to isolate what is this. Nothing was coming up positive, and eventually they isolated that it was this new coronavirus. And since that time, since December 31st to now, it's kind of mushroomed. To put it in perspective, right now, today, we have 28,276 confirmed cases worldwide. But there's also CDC released yesterday, there's 10 million suspected flu cases in this country, this year
Right.
so far. So, to put it into perspective, it's a big deal.
Yep.
But it's not reason to totally freak out and panic over it yet either, So, so it sounds like a huge growth, and it is a huge growth, but it's, again, perspective, 28,000 cases worldwide versus 10 million flu cases in the United States. We still should be much more worried about the flu.
It hasn't reached pandemic level. They haven't put it at that point yet.
Right, and that's basically because most of the cases outside of China, there are 24 countries right now with coronavirus cases. The vast majority of which are from people, who've been in China and they've gone home, or folks that were working in China and got evacuated to their home countries. We do have cases where, those folks came home, got sick, and then people living with them got sick.
Right.
And we have very, very rare isolated cases of third generation
Right.
spread,
It's
meaning
pretty close contact.
Yeah.
Secondary.
it's pretty close contact, except for, again, a handful of, 3, 4, 5 cases where there's been some third generation spread. So the concern is that, number one, it's new. We don't have immunity to it. Number two, it is showing a propensity to be contagious and spread relatively
degree,
ish easily. I mean, although it's not spreading like measles would,
Right.
I mean, it's not that.
Mhm.
But we don't have known treatments. We don't have a vaccine. In fact, the World Health, the Director General of the World Health Organization today said that we are shadow boxing with this because there's, we have a test for it and that's about it. So it's a rapidly evolving situation.
So now there are 2 cruise ships that are no longer allowed to dock or let their people off, and they're being. This was the thing.
7,300 people on 2 different cruise ships are quarantined inside their staterooms.
You see,
Not
I
allowed
wouldn't
to-
have minded. I would not have minded to be on the cruise ship if they said you can't get off and you have to stay on the cruise ship for 2 weeks.
If
But-
it weren't in the stateroom.
But yeah, having to stay in
Right.
your room because at a cruise ship, your room's not exactly like the
No.
nicest place to be.
Well, and the mental idea that you can't leave. I mean, it's one thing if you're in there and you kind of have that, oh, I can leave when I want, but being told you have to stay here, I mean, it adds that extra layer of feeling like you're in a box.
It does. And then when you add like some of the pictures that they're posting of their food, so
Right.
the cruise is over at this point,
Yes.
folks. You're not going to get the great
No.
food that you
No.
had, so just the level of boredom, I think, to be locked up in that small of a place is alarming. Now, something the U.S. has done for the first time in 50 years is quarantined Americans who have come in from China.
Right.
But at least they are on military bases, and I don't know what their accommodations exactly look like, but it's got to be a step up from, a 10 by 10. I mean, literally, the radio booth here is about, 10 feet by, 12 feet, I don't know. That it's about the size of a stateroom,
Mhm.
and I can't imagine being locked inside this for 2 weeks.
Well,
I
and
mean,
having
that's-
the fear of potentially developing this, infection. So,
Yeah, you have the fear of that, but then also the lack of mobility. Like, how many people are going to have DVTs and PEs?
Yeah.
And,
No
I mean, it's like,
Yeah.
you start thinking about this. This is, it's not good for these folks. And so many people on cruises are of an advanced age, or
Sure.
at least of maybe not advanced, but the 50+ crowd
Sure.
is heavily represented on cruises. There was an individual this morning that was posting that he had 3 days worth of medication
Mhm.
left. You pack for a trip, and even under, if you're being very responsible,
Mhm.
and you've done what we request that you do, and you've packed several days extra of medication,
Who would think?
we generally don't
Yeah.
travel with our entire medication chest with us,
Right.
So there are going to have to be accommodations made for medication and things like that. But this becomes very, very complicated beyond a few days after when the cruise was supposed to be over anyway.
Absolutely.
So,
And the whole situation, I think, reminds everyone of how serious, things can get. Because I think it falls out of, we had SARS, right? And
Mhm.
I remember when that was this big thing. And I think how soon people forget, and like you said, I mean, we certainly have a lot more influenza right now. There's concern that this coronavirus could get worse, could become a pandemic, and at the same time, I think it's interesting how people, it's influenza is a big deal. Coronavirus now is like taking the spotlight. I very rarely hear them talk about influenza cases, whereas
Right.
previously, every night you get the update on the influenza, where are we at in the U.S. Well, now it's all coronavirus, and not that we shouldn't take it seriously,
Right.
but I think there, like you started out with, there's perspective, and it
Yeah.
reminds us how global we are.
Yes.
and
Right.
How small
how
this
small
planet
the
is.
world really is. And I was listening to Dr. Radio, imagine that, a couple days ago, and they actually had Dr. Fauci on, who was the director of the allergy and immunology, maybe NIH,
Mhm.
and he was talking about the whole coronavirus and the idea of quarantines and pandemics, and he pretty much said, quarantines are not perfect, and it's very, very rarely are you able to really get a quarantine that works so well that it really stops
Right.
spread totally. And so really what a lot of these quarantines, travel restrictions and so forth, what they're really doing is delaying the inevitable. So if it's going to become a pandemic, it's going to become a pandemic whether or not we quarantine, for the most part, and partially depending on where those people may be going, and spreading it. But at the end of the day, it's giving us more time
Right.
to. He was talking about development of a vaccine.
Yeah,
that,
exactly.
that where they have learned over the last decade really how to use RNA and so forth to get in the course of 2 to 3 months the ability to really get clinical trials going. And so yes, it may still be a year or more before they really have a vaccine, but the overall process of creating one has really diminished. So
Yep.
it delays probably the inevitable if it's going to be a massive pandemic.
But here's my
Exactly.
question.
And I think that delay is important. Scott and I was lecturing Scott about this because I heard that the same gentleman, I'm sure, was saying something similar, and I was like, you know what? Because he was a little bit poo-pooing the
Yeah.
quarantine thing, and I was like, you know what? I hate to take on the director of this big thing,
Right,
because
right.
I'm me, but I do think that there's an argument to be made for delay because
Absolutely.
like the World Health Organization has just yesterday shipped out 250,000 test kits.
Mhm.
The big concern is, oh my goodness, if coronavirus travels to Africa,
Oh,
it
boy.
is a big problem. It is a huge problem. So trying to get that contained.
logistics.
The
I mean, and
logistics.
he was making the point when I was listening. They were talking about that this particular virus is much more happy with dry, kind of not cold but cooler environments. Whereas, so that the only kind of saving grace, if you will, for
Right.
potentially like Africa, is that it's a warmer and
Yeah.
certainly a lot more humidity, so that there may be a little bit less than it would
Right.
have been
Right.
comparatively. And that was an interesting discussion point too, is as certainly in North America, as things get warmer, as we move into more of a spring and then summer, will we see, even if it does sort of start to blossom more in the US right now, will we see a decrease over the summer, and then will it reemerge in the fall, which is another
It become a seasonal
question,
issue.
right?
Yeah, and that's where why this is a bigger story than the flu. Honestly, flu is kind of, I hate to say it's tired, but it should never be a tired story
No.
when you lose.
Right.
They're saying like 10,000 deaths this year so far, is what they're estimating. That should never become a tired story, but it is somewhat of an expected thing. So the
Right.
difference between an epidemic and a pandemic is, an epidemic is where there's usually a significant increase above what would be normally expected to be occurring in that area. So flu right now sometimes does reach
that
epidemic levels, but there's expected to be some level of flu this time of the year. A pandemic is where something, depending on who defines this, and that's the other thing, it gets tricky
There's
because
not
there
a
is
really
no hard
great-
there's no hard
Yeah.
and fast. But the World Health Organization basically says the worldwide spread of something new. the reason it's not a pandemic yet, because folks on the internet are just going like it's in 24 different countries, it's a pandemic. No, it's not, when most of those cases
They're
directly
there.
came from
Yeah.
China. They're transplanted cases,
Yep.
which is scary in some ways, but you really don't have a pandemic until you have spread beyond people who brought it back and their
In
very
their
close
immediate
contact.
family
Yeah, and
contacts,
it continues beyond just
Sure.
a few initial
More
cases.
community widespread.
Yeah, exactly. I mean, if this thing starts growing legs
Right.
in multiple different countries or different continents, and it's not very quickly contained, then you have a pandemic, generally speaking.
Right.
Although there is no defined, there's no perfectly defined situation for
Right.
this. So
Okay, so now tell me this. Let the skeptic here have his say. All right? 10,000 people are dead from the flu already this year.
Mm-hmm.
The numbers on the coronavirus are showing maybe 4 or 5% of the people that are dying. For
Well,
most people, the
2
symptoms...
to 4%.
And that's of the cases we know about
And
too.
at
so,
this point, this is not something that is sitting back here saying this is going to kill billions of people. This is, for me, and explain to me why I should be more worried about this than I should be about the flu.
Well, first of all, we should all be a little more worried about it if it were to actually start growing legs, because we
Yes.
have no defense. We have
Right.
no natural immunity to this, and we have no vaccine.
and to see how much it as a virus can change
Exactly.
and so that's also the mutability, what is it? The mutagenicity, I think is
Right.
the term, but how good is it at evading our immune systems, and is it going to quickly do that? Is it one that really you see it, and then now that our immune systems have it, no more of that.
Yeah.
So I think it's the questions really.
Yeah.
We know the flu, right? We're familiar. It's our old friend.
Right,
You know,
yeah,
and-
unfortunately.
Yeah, exactly. But for this coronavirus, I think it's novel, right? It's new, and that's the concern is
Yeah.
we can go one way or we can go the other.
And the other thing that is somewhat concerning about this, and I think what has really made you pause and look and say, okay, there's something going on here that's unique, is that we have already surpassed the number of, the coronavirus numbers have already surpassed in 1 month the number of total SARS. Cases in like over a year.
Mhm.
So that's one thing. Now, here's the other thing that adds to this is the mystery and the intrigue of, do we trust China? Do we not? They weren't forthcoming last time.
Numbers.
This time I think they have been, because we have not seen kind of spread of this. That did not begin until after they came out and said, we have a problem.
Right.
And so I do think they learned. I don't think that we trust them without any type of oversight at
Right,
all. That's
right.
not what I'm saying. But I do think that they spoke up rather quickly. And so that kind of adds to this too, not knowing who to trust with numbers. But it's important also to realize your early cases will very frequently be the more severe cases.
Right.
Because what happens is these folks were hospitalized for pneumonia, and they couldn't figure out what had caused it, which is a little unusual after repeated culturing and things like that. So what we do know about any type of outbreak, so there's always more flu cases than confirmed flu cases.
Absolutely.
Because there's always people with relatively mild flu-like symptoms that either think that they have a severe cold,
Right.
or they figure, I've got the flu, I'm going to stay home, and they never go and seek
Right.
care for that. So the thing is, at the onset of a new illness, the mortality rate may look higher than it is, because what we've done is we're only identifying the people
Right.
that were bad enough to be hospitalized for it. But that said, if you take 28,000 confirmed cases, we can very safely assume there is a significant number more than that.
Absolutely.
And different people have done different universities actually have come out and done different studies, and the numbers are all over the place depending on what type of model you use. But they're talking about 100,000 cases not being unreasonable.
Right.
And if you start thinking about that and the fact that we think maybe perhaps each person who gets this spreads it to 1 to 2 people or 3 people maybe, it grows legs very quickly.
Right.
Now, the good news is we've identified it, and people will be much more likely to, especially in China. Well, in China, they honestly, they don't have much of a choice. They're quarantined. They have quarantined 55 million people in China to their homes, or, basically you can go to the store and go back home. I've tried to do some research on this, and as far as I can tell, that's unprecedented, where an entire 11 million person city, Wuhan, was totally shut down and quarantined.
And that's what boggles my mind about it. And I said earlier how global really the world is. I mean, how connected we are. But I can't imagine if that happened in the United States.
People would riot.
Like Decatur.
Yeah.
Or Springfield. I mean, these are small, comparatively, cities. 11 million people. That is, so
That's
many.
Chicago.
I mean,
Yeah.
I can't imagine, and maybe that says something about Americans in general, but I mean, the calls for how it's violating
Human rights,
human
yes.
rights and this and yet I think a lot of people, when we look across the water, say, oh yeah, that's good, keep quarantining,
Right.
keep doing this.
Yeah,
But
keep doing it.
I think sometimes, wow, what if I was somebody living in that community?
I think
It's
I don't think in the United States it could happen,
Holy
because I
cow.
don't think Americans would tolerate that. And one of my thoughts on this, number one, is we wouldn't be able to tolerate it because our economics aren't set up to. In China, where you have so much of their income, so
Right.
many. I mean, they're paid by the government.
Sure.
So the government, if they tell you don't go to work, well, you're
you
still
get
gonna
the paycheck.
yeah, you're still going to get the paycheck. In the United States, where we're a capitalistic environment, it would be devastating. I mean, it's devastating to the Chinese economy, no doubt about that.
Yeah.
It would be complete annihilation of the American economy and all of the independent business owners. And, it would really be Armageddon, and it probably is going to be for them. But when you think about the realities
Right.
of quarantining 55 million people,
Right.
that is, it's
mind-boggling.
It's mind-boggling.
It is.
it's mind-boggling. And again, you have to think about, and there are concerns over human rights and that type
Sure.
of thing. But there've been concerns with human rights in China anyway. So like that's new, but there's never been a government mandated quarantine of this magnitude, I don't think, in the history of
I'm
Earth.
not aware of it.
I tried to look into smallpox. Because I thought, that was a big one. I tried to look into, polio, and the 1918 Spanish flu. Some of those happened during eras in which we didn't understand germ theory and germ transmission as well. So, like, people weren't quarantined because we didn't know that would be helpful. But I haven't found anything on the order. So, China's getting a lot of criticism, and I'm not ready to trust them. However, they've done more than anyone else that I can see, in terms of at least, shutting things down.
Well, my wife has convinced me, and I've always been kind of convinced, that it's going to be bugs and not bombs that eventually kills us all.
Sure.
And if anyone, I don't know if you've ever read The Stand by Stephen King,
I've not.
or seen the miniseries or the movies that he's put out on it. It's beautiful, wonderful book, scary as all
Probably
heck.
terrifying, it sounds like.
It is terrifying.
Yeah.
But it's about a pandemic that ends up basically destroying the world.
Yeah.
And when I hear, and every time one of these things comes out, those are the first things that I think of. But when I hear this of the coronavirus, I just don't see that being that. I can't.
I think that, assuming everything stays the way that it is, I mean, in terms of its the mortality rate and its ability to be
25%
transmissible
of cases are severe, which means 75%
are not. I mean, when you look at influenza, you look at other known that we've had for a long time. Yeah, it's not this magnificent thing that's unlike anything else. It's just, I think, the possibility that you can have this worsening that gets people really nervous. And for me personally, I'm not, I'm going to Chicago in a couple weekends, actually right before my dissertation defense, to see a good friend up there. And, at this point, I'm not going to cancel my plans, even though there are some cases in Chicago. I'm not planning on not
No, I
going.
wouldn't
Yeah,
worry about
and
it.
we put our daughter on a plane, and she flew to Arizona. It was like,
and it doesn't. Yeah, you're more cognizant of things, but honestly, for me, it's not going to change anything because I already, especially in the winter, but all the time, am constantly washing my hands. And if there's people around me coughing, I'm not, trying to follow them and take deep breaths. And I'm going to do those same preventative, basic measures that everybody should do. Period. Because of the, influenza and
It's
everything
flu
else.
season, right.
Colds and, everything.
so.
And that's
so
the thing. I still think the flu right now in this country is much more of a threat and a concern
Sure.
than the coronavirus.
Yeah, and frankly, antibiotic resistance is probably an
scary.
even bigger threat than influenza.
Absolutely.
So I mean, of all the things I can think of that's going to get us, it's probably not going to be coronavirus. But it is a good time to bring up things you can do to protect yourself. There's been great debate over masks. Do you have to have an N95 mask? Do you have to have a regular mask? Whatever.
Particle size.
It's particle size, but the other thing is it's distance too, and how long does it stay in the air. So if it's something like if it were measles or if it were even influenza, an N95 mask is super important because it can stay aloft a little longer. And the regular surgical mask has gaps, so if you're breathing in, you kind of suck the air in around and it comes inside the mask. But for a common cold, sure, an N95 mask is going to, stop more of it. But for a common cold, what that surgical mask is going to do, just a very basic mask, is number one, keep you from touching your nose and your mouth, which is probably the most important part of all of this. But number two, if you're sitting 3 feet away, 4 to 6 feet even better, if you're sitting that far away, honestly, you're probably not going to get hit by one of these particles. So, the mask thing may be a little overrated, although it's too early to say. If this is truly a heavy particle, the mask thing may be overrated, except that it keeps you from touching your face, which the importance of that can't be, overstated. But, the other thing is, honestly, this barrier between you and the person next to you. Like when I go in and see someone with the flu or a cold, I'm not standing right next to them for the entire visit. The only time I'm within 3 feet of that person is when I'm actually doing my physical exam, and I limit that. I go as quick as I can. I mean, it's not like speed exam, but it's as quick as I can, and then I step back, and I'm very frequently, kind of back, kind of by the corner talking to them. So distance is really important. Cleaning surfaces is really, Lysol is a great thing.
I haven't seen data on how long it's staying alive on surfaces. How
I
long?
have not seen reliable
that was something
data.
I was interested in.
Yeah, I had heard anecdotally hours.
Sure.
It was one that tended to land and stay. I also have not, like when I say Lysol is a great thing, we don't know if Lysol would actually kill that one. It kills a lot of coronaviruses, actually Lysol will kill. And another important thing is coronavirus, other than SARS and MERS, which were, severe. But the regular coronaviruses cause 5 to 30% of the common cold illnesses that we have every year. So yeah, I mean, there's so much we don't know, and so the the WHO actually just announced a campaign where they're trying to raise, I think it's $265 million to combat, or $675 million, excuse me, that they're trying to raise to research this and answer those questions.
Right.
You know, exactly, we know it's, or we think we know it's droplet transmission, but we don't know for sure what's the droplet size. How long does it stay aloft? You know, there's
Right.
lots of things that need to be known. But I think the important things are give yourself space between people, particularly if they look sick. A mask is, any mask is better than no mask,
Right.
and an N95 mask is, yes, probably the most protective, especially if it turns out to be a tiny particle
Right.
that floats around a little longer before it lands. Washing your hands.
Yes.
And not touching your face probably are the two most important things, to be honest with you.
And washing hands the correct way.
Yeah.
Not
Yep.
just turn the water on.
Right. Right.
And then turn it off.
Yeah. So like 20
That's a medical
seconds.
professional thing. I'm just telling
It
you,
is
you
so
guys
true.
love to wash your hands.
It is so true, but like 20 seconds with friction, and actually friction
Yes.
is more important than the soap's important too, because it decreases the surface tension, so the particles actually
Come
wash off easier. But friction is probably more important than the actual soap, to be honest with you. So friction, 20 seconds, and then thoroughly rinsing.
And then using the paper towel
Yeah.
to turn off, to dry your hands, and then use a paper towel to turn off the sink, and it's not an automatic one, and then to get out the door. If
Right.
It's
Exactly.
because the number of people that, go into the bathroom and do not wash their hands when
Yeah.
they leave is astronomical.
It is super scary. And then, if you coughing into your
Yep.
elbow.
The chicken wing.
Yep, into the elbow instead of your hands
Yep.
is super important, because you cough into your hands, you go grab that doorknob, or you go touch this or that, or heaven forbid you shake somebody's hand, but this happens
Yep.
all the time. Those are probably the most important things. And then also, if you get sick, this is good for any illness. If you're sick, not to be out, stay home.
Which is easier said than done. And
Yeah,
Yeah,
I
it
was
is.
going to say, I have a wife who, if she's sick, still, gets up and goes if she has to.
If I have to, but I will say that I have a mask on, and I have an N95 mask on, and I, wash my hands, and I'm Lysoling everything, and
Right.
I do stay home if I'm sick. But there are some times where I'm the only provider, and I've got sicker people than me that have to be seen, and that's the unfortunate reality of healthcare. But again, I'm standing at the back of the room. I'm taking precautions. I don't think it's reasonable for every little cold
No.
that everybody has to stay home, because we would all be out of sick time. But if you are sick, if you have a fever greater than 100.5 degrees, and it really, they just came out
I
with a
saw
thing that our body
Right.
temperature has fallen. So it makes me think, well, maybe we need to downgrade that to like that 99.9.
Yeah.
May
I
be a bigger
wondered
deal
about that
now.
when I saw that.
Yeah. Honestly, if you have a fever that's higher than your norm, and you know it, and you're really not feeling good, you should stay home. And I do stay home on those days, and it's like,
Okay. Last thing I want to talk about with coronavirus. Before we do that, I just want to mention that we're on 89.5 WJMU The Quad. This is the Faculty Lounge. And we had a Lazarus sighting today. The doctor from China who told
yeah.
his students about the virus
I
and
saw
then
that.
was arrested
It
and
wa-
then got it
He
was
didn't-
announced to be dead today.
Yes, he didn't tell his students. He went on social media into a chat room and told some close contacts of his that at his hospital they had 7 cases that looked like SARS, or was reminiscent of
Mhm.
SARS, and he was worried about it.
And then they said he came back to life. So he was dead and he was alive.
Yeah, Chinese news media apparently reported this morning that he
I
had
saw that.
died.
34 maybe, something like that
Yeah,
years old.
too young. And the other thing that was alarming about his case was he had been sick for so long. I was listening to an interview with him yesterday, and you could tell he was dyspneic and having a hard time labor breathing and things like that during the interview. And I thought, boy, he is just not coming out of this. And I think that has been the concern, is that it's an unusual, if it takes that bad course, it
Right.
doesn't
Well,
go
and
away. It
perhaps
doesn't run
there's
its
a
course.
vulnerability that we don't know about yet. That
Right.
For certain people, it's perhaps highly lethal, but for everybody else, it's
Right.
run of the mill. I mean, you're not going to
Exactly.
feel good, but you get over it.
Exactly, but he was very obviously not doing well yesterday, was reported to be dead this morning. They brought it up at the World Health Organization press conference,
Right.
and they didn't confirm or deny, but then right after the press conference, they tweeted basically their condolences. And then it turns out the Chinese media saw that, and they were like, "No, he's on an ECMO machine, which is like a heart-lung machine."
It's pretty
and
close.
So now they're saying that he probably coded or arrested and was put on this heart-lung machine, and now he's in critical condition. So
Right.
either way, it's not sounding good, and that's
Right.
really it is unfortunate because in China. And this goes back to them not trusting everything that they say. Yes, they came forward pretty quickly, but they still were harsh on someone who, kind of made an
Raised
announcement
the
to a
flag.
raised a flag to a relatively smallish group of people, from what I understand. So I
Right.
mean, Americans worry about Big Brother watching them. Well, Big Brother over there is a lot more aggressive than it is here. So.
What are you two seeing going around? What's going around right now? I know that you've seen some stuff at work, and you're back in the hospital setting with your students. So what are you guys seeing?
On campus, actually, some influenza B, and not. I was having a conversation with somebody at the health center and just kind of said, I've seen a lot of influenza B because I've been hearing that, and I've had some people tell me that that's what's going around, and they said a little bit, but not. Off the charts, everybody that they're testing is coming back positive. So I think some influenza B seems to be the predominant strain that we're seeing with students more so than A. So, influenza B, you get all the nice stuff from influenza A, the respiratory symptoms and the aches and that, but then you add in some digestive symptoms, with influenza B. So that seems to be what I'm seeing from a student perspective. In the hospital, I haven't been around enough yet to really get an idea, and in fact this semester I'm on the psychiatric mental health unit, so it's a little different there compared to some of the other
Yeah, I guess with that it would be
units,
depression and anxiety.
a lot of that, but the thing is with those units, which is interesting, is there are certainly common areas, and there's a lot of interaction in those common areas. So if you have one or two patients in the hospital on one of those units with influenza or any other really communicable issue, it can spread very, very quickly on those units.
Yeah. Jamie, what are you seeing?
So I'm seeing the flu, and CDC, flu B had been predominant, and then on yesterday's update, or the most recent update, flu A had finally jumped ahead of flu B. That's somewhat concerning. That I hope we're not
Late
going to have
start.
another bimodal season,
Yep.
But so we've seen more flu actually in the past couple of weeks than we had prior to that, and it's all been flu B. In my cases, have all been flu B. We're seeing strep throat, and we're seeing a virus that is interesting. It's almost like hand, foot, and mouth disease. So folks are getting mouth
Rashes.
sores, but they're also getting irritation and peeling of skin in their ears, which we had never seen before. I hadn't seen it, and the MD I work with hadn't seen this too, and we've had a few cases like that. Now, who knows if that was just incidental, and
Right.
the cases I saw were not, tremendously sick, like they have mild illnesses. So it was just kind of a weird. I wonder what that is, and I don't know if it's like a Coxsackie virus, which causes hand, foot, and mouth. But it looked like that in the mouth, but did not have any involvement on the hands or the feet, and then the ears had some kind of small sores on them. So that's really what's entertained us. Oh, and there was some, like a viral gastroenteritis that was fairly severe in some patients. So we've had that too.
So you guys are both seeing kind of the same thing. What you're seeing here at Milliken is very much what you're seeing out, at work, which means what? Is that a regional thing?
Yeah, well, it's widespread.
It's widespread.
In the U.S., it's widespread in Illinois, and it's widespread in most states at this point. So, yeah, that's typical right now.
Okay, have you gotten your flu shot?
Oh yeah, I got it in the fall. Actually, a little bit earlier than I would have wanted to, but based on when I had to for certain requirements, I had to get it earlier than I would have preferred. But yes.
I got mine way early because my grandson had a mass in his lung, and he was having half of his lung removed, and so I got it, way
Right.
early. So yeah, I always get my flu shot.
Well, I know, but I just wanted to ask if John had his.
I don't know anybody, honestly. Well, you hate to generalize because everybody or anybody is always the wrong answer, but most folks that work in the hospital don't have any problems getting their flu shot if you're going to take care of flu patients. There's always a couple people that
Sure.
don't like it, but most people will get their flu shot. So.
And I think we've been talking about flu and coronavirus and everything, and I would be remiss not to remind everyone. I kind of brought it up earlier in the first half, but it's Heart Month, February, and coronary heart disease is the #1 cause of death for people. So, for what it's worth, high blood pressure and high cholesterol and all those things are something that are to some degree modifiable risk factors, things that we can control, and I think we have to always remember that. Sometimes I think that the novel kind of things like coronavirus, the sorts of things that we don't have as much control over get more of that attention, and it's important for people to remember that still heart disease is the leading killer, and there's a lot of things we can do to reduce risk and so forth.
For a number of years, my wife used to post on Facebook every night, "What did you do for your heart today?" Mm-hmm. And for a very long time, this was a post that her friend group really paid attention to. It actually drove one woman to go on a massive weight loss campaign, and she lost
A lot of weight.
Basically changed her entire life. And it was just from the "What have you done for your heart today?" Now,
And the point was, do one thing do something every day where you made a conscious decision that I'm going to do this because it's good for my heart
Right.
health, and it didn't have to be the exact same thing every day.
Right.
But eventually, when we start thinking about that at least once a day, it does tend to lead to thinking about it other times too.
Now, the problem, as with everything that starts and happens on social media, after a while, people started putting really stupid answers down.
Like I had 10 Snickers bars, and haha.
Right.
And so finally I stopped doing it. But I think I did that every day for like three to 5 years.
And it really, I think it made a difference. And I think simple stuff like that, makes a difference. And that's, I'm going to plug her page again, but that's why I find her page to be so interesting. The Jamie Whitmer MSN APNR page.
HERN.
I get them. I'm close.
We do like our letter.
We do.
You
we
have
do.
a lot.
It's like
You've
we
got
just
the
like
whole
to have this whole
alphabet.
huge
If
thing
Jamie
behind
ever
her name.
did her entire thing, she's
It's
got
like
the
this long.
entire
It's
alphabet
ridiculous.
except for Q.
I know it is a little absurd, and the thing, and I do think that that's a problem in nursing,
Yep.
actually, and in medicine in general, is we've got all of these different designations, and nobody knows what that
What the heck
means.
it means. Yeah.
Like, and at the end of the day, they want to know who their clinician is, you know, who's their healthcare provider, and they want to know who their nurse is. They don't. I mean, it's important for us to have these designations, but really from the patient's perspective, they want to be able to tell the nurse from the janitor, because, and not so much that they don't like the janitor,
Right.
but it's like if they want some as needed medication, sometimes they end up asking 6 different people because we all look alike and we have
Right.
we all have weird initials behind our name. you
Well,
know?
here's the other thing, and this is something I talked with my wife about this because I was about to go visit a nurse practitioner at the Springfield Clinic. And it's a problem that I see and that I complain about, and I'm not sure what people who are nurse practitioners do or should do about this, but we have been trained as people to go to the doctor.
Instead of
All right, and the thing is,
I always use the term healthcare provider. So your healthcare provider.
yes, and I'm learning that. But the thing is, as a person, I've been taught to go to the doctor. Now, as I've gotten older and I've started realizing the differences, basically I much prefer going to a nurse practitioner because they are looking at things a little differently often than a doctor might. They are definitely looking at the whole picture more than some doctors might. And I'm not making any cracks at doctors or taking any shots at them. I'm really not. But I have come to prefer that. Maybe it's because I'm married to one. Maybe
Probably
it's
is a lot.
because I've learned from experience. But the thing is that I do not know what to call my nurse practitioner, and I think that's a major problem.
Well, I think usually a provider will come into the room and hopefully they introduce themselves, and then you know what to call them.
Right. But
Yeah.
I think though it's interesting, the idea of, well, is this doctor so and so? If you have a DNP and you're a nurse practitioner, well, using the term doctor, whoever, then creates confusion because then it's hard to, unless you're looking at their credentials. Well, okay, we doctor, but what do you mean by doctor? And then, do you call them by their first name? I mean, certainly that's. But it's interesting to me. Then you have, well, we call the nurse practitioners by their first names, but then all the doctors you call doctor.
And that is a complete issue with respect, especially for older people.
Yeah.
The whole idea is I'm supposed to call you by your first name.
Yep.
Well, that must mean you're not as important. It is a mental thing.
Yeah, I will say that the MD I work with goes by her first name.
Yeah,
With her
that's
patients,
certainly
so
varies.
it's and she's younger.
Right.
She's a few years older than me, but I think some of this is changing over time, and
Yeah,
we'll
it's a
figure it out.
gradual- it's an interesting. We certainly see more and more nurse practitioners, but I think along with that, the pathway to become a nurse, just at the nurse level, and there are so many different ways to become a nurse, right? And then past that, there are so many ways to become a nurse practitioner, and then we have all of these specific types of nurse practitioners, and at the end of the day, I sometimes wonder if we have grown so fast and created so many programs and things that we're not always as attentive as we should be to really that quality control. And it's and it's again, that's, I think that there are absolutely wonderful nurse practitioners, but there are some also that are not.
Right.
Just like we see
Right.
that with
With
physicians
doctors and with everyone else.
and so, but I sometimes worry that, if we have too many people graduating that are not well qualified and are not doing a good
Exactly.
job, they create a bad name for physician's assistants or
Yeah.
nurse practitioners or whoever that particular.
Yeah,
group
and the
is.
autonomy we fought for
You're
will
right.
go away if
Yeah.
you have subpar
Absolutely.
clinicians. And I see this as I'm a clinical instructor, and so at the NP level, in clinicals you're one-on-one
Yep.
with your instructor, and I see there's always going to be a continuum of where people are at with
Sure.
their education, and some folks are going to be extraordinary and others are not. And I don't mean that the non-extraordinary folks are bad. It's just there's always going to be
Right.
kind of everybody's on somewhere.
Sure. And some people have certain strengths that others don't, and vice versa.
Right. But one of the things that I have a concern about is when I went to MP school, and I've been a clinician now for 7 years. So 10 years ago when I applied,
Right.
you had to have 3 years of full-time practice as an RN
Yep.
in a critical care setting. Now I was applying for family practice in a critical care type setting, and they kind of delineated that, like ER,
Right.
check that box, ICU, check that box,
Sure.
that type of thing. But you had to have 3 years of full-time experience after you had completed your RN education.
Mm-hmm.
And now, years ahead, they did this thing where they said, okay, everybody's going to be doctoral prepared, but then they didn't quite
Right.
follow through on
Right.
that. But what happened in the meantime is they've allowed people to transition from their baccalaureate program straight into a master's or a doctoral program, and you have people hitting clinicals that have never worked full-time as a nurse. And they haven't had the years of developing their clinical assessment skills, which are what nurses do best.
Yep.
And that gut feeling of, this person is in trouble. And it's this visceral feeling you get. You walk into a room and you know it because you've seen
and
it.
at this point, for us to change some of those things, I think it would take the accrediting agencies to make those changes and say this is how it's going to be, and you have to be accredited. You have
Right.
to do that because it, like many other things, it's a competition, right? The various
Yep.
schools, the various programs, they're competing for students. And so when one program says, well, you used to have 3, but we'll let you have 2 years of experience, so come to
Right.
us because you
Right.
only have to have 2 years. Well, then all the other programs change and become 2 years, and then the other one says, well, we'll let you have 1 year of experience, or then, you don't even have to have any
You
experience.
can just go straight
You
through.
know,
Right.
and so it's become this competition to get students because we want students, but at the same time, I think that changes have occurred overall, not just with levels of years of experience, but with other things as well.
Right.
And I'm not sure that that's just going to be all the schools are just suddenly going to say, hey, we're going to ratchet
gonna
things
do
and
this.
change things again.
No,
Right,
and I think
feel
that
like what they have to do is they either do have to make that decision, or what MPs need to be doing is a residency,
Absolutely, yeah.
post-training.
Yeah.
Because as of, when I was trained, we didn't have to do that, but the thing was that we had worked for 3 years.
Yeah.
We had extraordinarily good assessment skills. And then we did this extra training, and then we did pretty intense clinical training, like 9 months of, pretty much
Right.
full-time clinical experience on top of that. And then when we graduated, we weren't required to do a residency, unlike the medical doctor
Right.
who, unlike the nurses, hadn't had, a few years of full-time work
Sure.
experience, so they make them do a residency.
Right.
And anyone who's worked in healthcare knows that the first week residents are pretty green, as
And you learn.
as they would be, as nurses
Yep.
are when they start. But you're going to have to do one or the other. I think it's, we're getting to a point where we should do that, and that's probably going to make me not popular amongst. But I do think that there's some professionals or a lot of professionals that are like, okay, wait a minute. Some of it is. They're not making them walk through 5 feet of snow like I
Yeah.
did, but I mean there are
I think
legitimate
there's a larger
concerns here.
point. Yeah, I think there are larger concerns that are valid.
Yeah,
For sure.
yeah. So sorry to get off on that.
no, I think that was very interesting, and it's a point that I've been kind of questioning. I agree. I want people who've got experience. I remember when I was going through and working on my PhD and Jamie was going to school, she was still working on the floor.
Mm-hmm.
And sometimes she would come in right after at one of the places she was at. They would have residents going in. And, the difference in knowledge from an RN.
And a
who's
resident,
been
there
working.
are RNs. I mean, I hate to say this, the experienced RNs, the intelligent residents will ask them for help, and they do help. And I'm not saying that the RNs are smarter than the residents, but that first, again, especially that first 6 months, and it's not that medical school doesn't prepare them well. It does.
No,
it's just a different, the way that
Just
their
the
model is set up.
logistics and
The whole
It's
idea
how it
of
all
works.
clinicals and what you
Yes.
guys do is daunting. I would never want to do that. I would never want to have to walk in and start assessing and going through. I think that would be very difficult.
It's really daunting. It's really daunting. And again, as a primary care clinician in a hospital setting, I hate to say this, but if you have some skills that are a little shaky, you're part of a team.
Sure.
Somebody generally catches it, and that's the way it's supposed to be.
Right.
So if you had a bad day that day, someone's going to catch
Sure.
the ball for you. You know, that type of thing. Primary care is those safety nets aren't as in place.
Right.
So
Especially
you
as,
have to,
as it's more and more autonomous, and it's
Exactly.
more and more, you know,
exactly.
reaching out to rural areas, and you may be the only person there.
Yeah, yeah. I mean, when I'm in Mount Pulaski, I am the only healthcare provider in the entire town.
Mhm.
You know, and even though we don't care for the entire town, and
Sure.
we're not in urgent care, we still get folks that walk in that aren't our patients but are in trouble, and they also don't have a like an advanced level paramedic service, so those folks have to come from Lincoln. So until the ambulance can arrive from Lincoln,
Sure.
you've got 15 minutes, you know, where, you know, we had somebody run over in the parking lot at the nursing home, and, you know, things like that you're caring for. But, you know, you do have to have assessment skills and have to learn to, one of the things that RNs learn within 3 years anyway, is that gut feeling and to listen to that. So, but yeah.
Okay, so I just have to give one thing out. I don't. Did you watch the State of the Union?
Parts.
Did you make it through parts?
Did you walk out at the Presidential Medal of
Well, you
Freedom
know,
awarding? Because that's when I
The
left.
thing is,
No, you came back and got even
you know,
angrier.
so in general, my approach to things, I don't want to shut myself off from things that I don't necessarily like or agree
Right.
with, whatever. You know, when at all possible, I want to know all sides. You know, if I were ever the president, I would want people in my cabinet, or, you know, at least my advisors, who had differences of opinion, and where, you know, we could go back and forth. And so I don't want to just say, well, I'm not going to watch that because I don't agree with it, or, you know, it was hard. It was difficult, and especially the Medal of Freedom, and you know, outside of, you know, it being Rush Limbaugh, what I don't understand about it is, if he can get it, what about? There are so many other people just as deserving who've done very similar things, conservative, liberal, whatever. I just don't get it.
No,
It's not for that.
Yeah.
Yes, okay. What Trump did was totally disrespectful to every person who's won.
Previously, yeah.
All right. And when you think that Rosa Parks is a recipient of that, when you think that on the same day that he honored a Tuskegee Airman, and that was the best thing that he could have done in that State of the Union address, and then he goes on to give Rush Limbaugh,
Who doesn't have a good history with?
who he's I'm
Anything.
sorry, and I do not call people this very often, but he's a racist, he is a sexist, misogynist, he is not good to people, and I'm not happy that he has cancer. I don't wish him
No,
to
no,
die.
no. I'll pray for
I
him
don't
every
think
day,
any of
you know.
that. But he has done more to destroy the credibility in my field of journalism
Sure.
than any other human being on earth.
I think that the closest comparison is Ellen DeGeneres. God,
Yeah.
you know, and so
Yeah.
I tried to, you know, was there a liberal entertainer? Sure. But the difference is Ellen DeGeneres was out as a lesbian in an era in which that was extraordinary, and she fought a lot of battles for a lot of people in a generally very classy way, and she is stuck up for the little guy, and you know, so. And now, some of this is my liberal mind thinking about this,
Right.
but if you put the body of work of Ellen DeGeneres up against Rush Limbaugh and just some of the caustic things he has said, there's still no comparison, and you can still make an argument for Ellen DeGeneres in terms of the civil rights battle that she carried, you know, for millions and millions of people, versus Rush Limbaugh, who, you know, just reading some of his quotes today, I went back and read, there were articles, and it was like, oh.
And I think, too, even if somebody wants to take the position of, well, Ellen, you know, got this, and so, you know, so should Rush. I mean, I think at the end of the day, that whole argument, I hear it all the time. Well, this person did that, so I'm going to do this.
Whataboutism.
Yeah, I mean, at the end of the day, if it was wrong the first time, it's still wrong now. I mean, okay, so if you break the law, you do something illegal because somebody else did it before you, okay, yeah, maybe there's hypocrisy there, absolutely, but it still doesn't make it right that, you know, for something to happen now just because it happened before.
Now, I predict we haven't seen the craziest, because I looked into this, and there is no rule against awarding yourself the Presidential Medal of Freedom. So I just want to throw that out there, because there's that, and family members could get awarded the Presidential Medal of Freedom. He does seem to have a preoccupation with his daughter, so there's that. You know, I mean, I'm just throwing out there though, but there is no rule against you can't award that to yourself. So stay tuned.
And I'll just finish this with this comment: there would have been no Trump if there weren't a Rush Limbaugh.
Sure.
Oh, absolutely.
And
everything that's transpired since he became.
Because of what Rush Limbaugh started.
Yeah.
However, if you're Donald Trump, and I'm not sure that he has the ego, though, to realize that that Rush Limbaugh is birthed Donald Trump, but
oh, that was an image that I just
no. But that said, that would be the argument possibly for awarding him the Presidential Medal of Freedom, because of course we had President Obama awarding, you know, Joe Biden the Presidential Medal of Freedom with distinction. Not that Joe Biden, you know, was the creation of Barack Obama, but you know, kind of a you help me out, so I'm giving you this.
Right.
But again, the body of work of Joe Biden is pretty tremendous, going back, you know, 30 years. I mean, we're talking decades.
So, anyway, this has been a horrific week. It has not been quite as bad as the second week of November in 2016, but it's been close. And I'm just going to leave it at that. This is it for today. Thank you very much for coming on, John. We always love having you here. We'll try to get you here again soon. And we may just bring you in for a few seconds to tell us how nice it was to get your
dissertation defended
and done. And we'll be back and talk with you soon. We'll see the rest of you next week on 89.5 WJMU The Quad. We should have Dr. Dan Monroe and Provost Jeff Aper here to talk about Abe Lincoln. So that should be a really fun show. And we'll see you all next week on the Faculty Lounge on 89.5 WJMU The Quad.
Yeah, I thought about that for a long time.